When taking your exam, it's extremely important that you read the question carefully to find out exactly what the test is asking you. Sometimes when we're in a rush, we can look over a question in a cursory manner and just jump to an immediate conclusion, which may not be right. So listen carefully to the following question, and then we'll look at the answers on the board behind me and come up with the best solution. Here's the question. In patients with type 2 diabetes, a modest amount of weight loss can facilitate significant improvement in glycemic control. How much weight loss is usually required for this result? Now, if you listen carefully to the question, we want to know how much weight loss is usually required to obtain this result. What result did we want? A modest amount of weight loss that facilitates significant improvement in glycemic control. So if we then look to the answers, we'll see if there are some that we can rule out or if one pushes us in the right direction. If we look at B, it says achieve ideal body weight. Well, obviously achieving ideal body weight would help improve glycemic control. However, if this person is significantly overweight, getting them to their ideal weight may be more than they can achieve, or at least make them so discouraged on the front end that they give up and they don't even try. So while achieving ideal body weight would produce significant improvements in glycemic control, the question said there is a modest amount of weight loss that can facilitate this. How much then weight loss is usually required to facilitate this significant improvement in glycemic control? So while B is technically correct, it really does not get at the heart of the question, which is why I said it's important for us to actually read the question very carefully. So we're going to eliminate B automatically. Although it would produce the result, it doesn't get to the heart of what the question asked. Now A says patient body mass index less than 30%. Now I don't know exactly what the percentage would be because they haven't given us that data. So this one is actually not a good answer because we don't have enough data to decide that. However, we can go with C and talk about their current weight and how much they would lose if they lost between 7 and 10%. Of course, D would be none of the above if none of these matched. But if we think about C together, we see actually that it is the correct answer in this case because with this modest amount of weight loss, remember that was actually part of the question, a modest amount of weight loss can facilitate significant improvement in glycemic control. This is a modest amount of weight loss, and it just so happens that that modest amount of weight loss usually, though not always because there may be comorbidity factors in their greater weight, but usually 7 to 10% loss of their current weight is enough to significantly improve their glycemic control. Now, part of this question also asks us to give an example of what this would look like. So I'm going to pick something simple. Let's say we have a patient that weighs 300 pounds. If they are to lose between 7 and 10%, we just do a simple mathematical formula here, and we get that they need to lose between 21 to 30 pounds in order to come down 7 to 10% off their current weight and achieve that greatly improved glycemic control. The reason this is important is that as you're trying to help people with type 2 diabetes, you want to keep them encouraged that they really can do what they need to do, that they can see improvements with even just modest weight loss. With achievable goals, the person is more willing to cooperate and will see greater results.